In the era before clean tap water, specialized medicine, or basic anesthetics, a single biological flaw could dictate a person's entire quality of life. An untreated cavity guaranteed relentless suffering. People walked the cobblestone streets clutching swollen faces, locked in collective physical misery with no medical relief in sight. When the localized nerve pain strikes, a completely healthy adult is instantly reduced to a trembling, sweating wreck. The sudden throbbing spasms shut down any ability to sleep, eat, or work. This cross-section of a human tooth highlights the core anatomical problem. The pain originated deep inside the pulp chamber, completely hidden from view. Because early humanity had zero knowledge of microscopic bacteria, the true biological cause of their suffering remained entirely invisible. Blind physical agony, combined with total biological ignorance, created a desperate medical vacuum. Patients and healers alike demanded a rational explanation for the torment inside their mouths. To fill that scientific void, ancient doctors hypothesized an active physical invader they could actually fight. This cross-section illustrates their universally accepted conclusion: the toothworm. Medical texts described an actual living parasite that burrowed into the hollowed-out chamber of the molar to chew directly on the exposed nerves. If you've ever felt the localized, pulsing, wiggling sensation of an infected tooth root, a burrowing parasite makes terrifying logical sense to a patient in distress. This map shows the global distribution of the toothworm Giri, charting an incredibly unified medical consensus. Notice how cultures in ancient Mesopotamia, medieval Europe, and East Asia, separated by thousands of miles and lacking intercommunication, all blamed their suffering on the exact same slimy culprit. Inventing a tangible monster provided a strange sort of psychological comfort. A physical worm, unlike an invisible curse, is an enemy that a desperate, untrained doctor can theoretically kill. But treating an invisible parasite buried deep inside human bone presents a major logistical challenge. The primary recommended treatment was thermal destruction, better known as cauterization. Practitioners heated a long metal implement until it was glowing white-hot. They thrust that scorching iron directly into the exposed dental cavity to burn the imagined worm alive, doing so completely without numbing agents. The overwhelming jolt of having a raw nerve burnt alive sends the human nervous system into complete, wide-eyed hysteria. Worse, the procedure frequently failed. The extreme heat destroyed surrounding gum tissue, but left the underlying bacterial decay perfectly intact. When the trauma of the cure matched the agony of the disease, patients were forced into the absolute final resort: the permanent, mechanical amputation of the tooth itself. Total surgical extraction was the only remaining path to relief once localized treatments failed. But there were no specialized oral surgeons available. Patients handed their jaws over to general laborers. The local barber was also licensed as a surgeon. The exact same person cutting your hair was tasked with wielding giant iron pliers for invasive skeletal extractions. These operations took place in cluttered wooden storefronts, entirely devoid of infection control or sterile tools. Ripping a deeply rooted molar out of a conscious human jawbone requires immense crude leverage. To survive the violent torque without suffering a shattered jaw, the conscious patient had to grip the wood with white-knuckled intensity, enduring every single crunch of the bone. Historical dental care was entirely a test of surviving raw, mechanical trauma in a desperate bid to end chronic pain. Thankfully, our modern reality breaks entirely from this gruesome history. For centuries, we hunted an imaginary worm, but when the microscope finally allowed us to look inside the tooth, we didn't find parasites. We found millions of microscopic bacteria. This discovery transformed dental care from a war against monsters into the biological management of infection. We traded the bloody, unsterile barber's chair for bright, chemically numbed care provided by highly trained specialists. A standard checkup today prevents the very decay that once cost an ancestor their teeth, or their life, without requiring a single moment of unnumbed pain. We live in the first era where a toothache is a manageable biological event, rather than a sentence of inescapable torture.